Hello everyone. Today, I want to share a story with you. A journey that takes us from the old asylum walls right into the digital halls of today. This is the slightly irreverent, but very true, epic of mental health nursing. Now, every good story has a beginning, and ours starts deep in the past, with the very roots of care. Long before we had the knowledge we have now, there were the first ones, the keepers of the keys, and in their own way, the first moral guides. In the very beginning, our role was quite simple. The Victorian keepers were sturdy people whose main job was to keep patients alive and, if possible, indoors a bit like bouncers with very heavy keys. But then, a lovely new idea, moral treatment, began to spread a real shift towards kindness and fresh air. The asylums themselves were often grand buildings, but inside you'd find some strange therapies like freezing cold baths. And the attendants, they were expected to be perfect models of virtue, keeping order with their character and a firm whisper. But a whisper can only do so much. A real change was needed, and it came with the dawn of professionalism. It's funny to think of it now, but back then, the idea that we should be properly trained for this work was a truly radical idea. The great Florence Nightingale's principles of hygiene and training began to influence our field, which was a blessing. Early schools were very earnest, teaching everything from basic care to the important art of not losing your keys. Then came our transformative leaders figures like Altschul, Butterworth, and Nolan, who pushed for us to use critical thinking and to be recognized as professionals. These pioneers are the ones who shaped our future, fighting for better training, for research, and for a respected seat at every decision-making table. And because of their hard work, the modern era began to unfold. The story of our profession now moves from behind the high walls of institutions and out into the world toward a more agile and community-based way of caring for people. It was a whole new chapter. This new landscape was born from deinstitutionalization, that bold, and, let's be honest, sometimes chaotic move from the large asylums into the community. The first community nurses were true pioneers, sometimes doing assessments in the most unusual of places. Our roles became so varied: fast-paced crisis teams, liaison ninjas in hospitals, child specialists, and now we are on the digital frontier. We're embracing apps, telehealth, and yes, the occasional video call where someone forgets to unmute their microphone. So, what does the future hold? Well, the challenges are still very real. We are battling workforce shortages, rising demand, and the eternal struggle for equipment that actually works. We look forward to innovations like AI support and virtual reality therapy. But no matter the technology, the core principle endures: that fundamental human need for connection and compassion. It's why we say the kettle's always on. It's a small reminder that simple empathy and care will always be the true spirit of our profession.